it's Jessica DeMassa with WTF Health, What's the Future of Health? And we are doing a special series on how different healthcare organizations are responding to COVID-19. So today I have a special guest. We have Margaret Nekic. She is the CEO of a medical malpractice and workers' comp carrier. So Margaret, and you guys are owned by hospital and physicians. I should say that before we move on. So Margaret, it's a pleasure to have you with us.
Well, thank you, Jessica. It's a pleasure to be here.
All right, so I want to jump in. This is kind of unique for me to be talking to somebody who's in the medmal world. And so I wanted to get, a sense of what's going on, as hospitals have jumped into crisis mode dealing with COVID-19. Catch us up on some of the more pressing concerns about medical malpractice and workers' comp at this point. What are you hearing from the hospitals?
Yeah, Jessica, all of this is new for everyone, but you can imagine the healthcare workers on the front line. They're trying to get as much help as they can so that they can care for these patients. And in these epicenters, it's becoming overwhelming. While in other areas, people are just trying to get ramped up. But you're seeing a lot of people come to the aid of those epicenters. So you're seeing people traveling into those cities to help and flock by the dozens, by the hundreds, to really try to relieve some of those those healthcare workers that are on the front line working double shifts, triple shifts, just trying to manage everything that's going on. And I think the other side that's missing too is the administration. They're trying to also deal with a lot of the legislation that's coming on, and they're trying to also keep supporting those frontline workers as well.
Paint a picture for me here about some of the things that are going on. Some of the examples maybe of things that are happening that we may not think of. And I hate to say, we should be thinking about, medical malpractice at a time like this, but it's really a function of managing risk and making sure that everybody stays safe. And some of these, doctors are practicing out of their specialty, and especially in some of these hard hit areas, New York, New Jersey, where they're being asked to jump in, or, some of them are being asked, around the country to go and do COVID-19 testing out of the typical hospital setting and, in the parking lot of a local Walmart. So, talk to me, I guess, about some of these things that we may be, just unaware of or overlooking when it comes to managing risk in a healthcare environment at a time like this.
Sure. So with those traveling entities, those doctors and those nurses that are coming, some of the doctors carry their medical malpractice with them. But nurses oftentimes are insured by the hospitals where they work. Mm-hmm. You're seeing calls coming in at the last minute to try and add different individuals to coverage. And, as a healthcare insurer and owned by hospitals and physicians, we're ready. We're ready to add. We're ready to help them in any way we can, because the last thing they need to be thinking about right now is their medical malpractice. And so really looking at it, and it's putting a burden too. They're going to have to credential these different practitioners that want to help. And so there's a lot that's going on, just trying to get people under the coverage and making sure that they are covered, making sure they're credentialed. Not to say, that it takes a while, but typically in a normal setting, it does take a while to onboard physicians, onboard nurses. And there's also risks in the fact that they're not used to using that equipment in those facilities. There are all different types of exposures that they're just in a typical way would take a long time to get up to speed on, that they're having to do in a matter of minutes, hours, not just days and weeks. So that does.
Your perspective as an insurer, how are you looking at this? Your job is to help these hospitals manage these kinds of risks and take care of their frontline staffs, take care of, their facility, take care of patients in terms of making sure that, certain processes are in place and everything is being followed. What are your concerns as you're looking at this and it's like, oh my gosh, things are so out of the normal mode of operations in terms of how hospitals run their businesses. How are you managing this? What are you advising them?
So at this time, we're watching as well. We're part of this as well, just learning as new information is coming out. But I think what we're trying to do is arm them with information and be their back-end resources that some of their staff may have done in the past, but now they're pushed to frontline. We're doing the research on what's coming out as far as information from other areas that have been affected, that have lived through some of this, so that they can start to be proactive and feeding them information and critical information, trying to be there for them and be their staff, but not being obtrusive, because they really need to be focused on that patient. but we're trying to look out for them in the future when they can consume more information. And as they can, we want to be that resource for them. Not that they're worried about paying their medical malpractice or trying to focus on whether or not this is covered. We're trying to be there along with them to take on this journey that they're facing right now.
And it really is a journey. And I think, even at the beginning of this week, we saw some legislation that was introduced in the Senate, talking about how to protect, doctors, as they're practicing on a specialty or they're using modified equipment. We've been hearing about, repurposing different things like sleep apnea machines, CPAP machines to use as ventilators. So some of this stuff is so out there. Do you think, this legislation that could be put in place to help, reduce the liability of practitioners who are well-meaning and are literally trying to cure people by form of miracle at this point? Do you think this will help in the long term as this crisis unfolds and we get past, the initial bump of this pandemic?
Yeah, I think early legislation, we're learning. So I don't know that it'll be as robust as possible future legislation is, but I think they're trying as hard as they can to create some laws that really do try to protect these individuals who are putting themselves in harm's way, trying to solve this crisis. And we're also involved in looking at some legislation too that says, hey, at this point in time, this is unprecedented times that we're in right now. Nobody really has the answer and nobody has the knowledge, but we're working through this together and we're trying to support them in that case too. So I think anything we can do to help them and listen to their voice to say, here's where we feel our biggest risks are. How can we be that support for those healthcare workers on the front line?
From the hospital perspective, I would imagine one of those points where they feel like their risk is the greatest is taking care of those frontline workers. What happens from a workers' comp standpoint if a nurse or a PA or even a doctor gets COVID-19 as a result of their job? What happens? Is that a workers' comp case?
It can be, but this is very difficult in these days to tell. Normally, you would say, okay, it's clear that this occurred within the line and scope of their duty. But many times this virus is so contagious that it could be them harmlessly going into a grocery store. It could be that, and actually healthcare workers have protective equipment. Grocery store workers don't.
Right.
So really, getting the infection and getting the virus could happen as easily as getting groceries delivered to their house. And, Jessica, many of us believe we're being quarantined or we're trying to use social distancing, but even those that have remained in their homes within the past month, there could have been a time, if you think about it, that you just harmlessly went out to the grocery store and you don't know where you've been infected or exposed. So it's very difficult in this time to say that for certain that occurred, that infection occurred while they were performing their duties.
All right, Margaret, I want to ask, and I hate to ask about the finance side of this, but I think it merits being brought up because, medical malpractice suits have long been blamed for contributing to rising healthcare costs. And I'm curious, so what happens now? What are you anticipating happening? In the short and in the long term here. How is this all going to play out? What do you think from your perspective?
Right. So actually, medical malpractice has been in a soft market for these past recent years, so much so that the cost for medical malpractice has been extremely low. And now we were actually starting to hear about the market hardening. I do believe that insurance markets are going to harden across the board with all of this. There are just so many impacts to risk at this point in time, and really understanding all of them. I think it's premature to try to understand everything that this will impact, but I do believe that all insurance markets are going to start to see a hardening across the board. And
I want to ask about that because, this is like one of those times, I think all of healthcare, isn't it? We're all standing here and it's unprecedented. We don't know what's coming. And there's a lot of, in all of that uncertainty, there is also opportunity. And I don't want to sound opportunistic, but I know, one of the sectors, that I cover, is digital health. I also cover, telehealth and virtual care. And the time right now for those solutions, they're looking at this as an opportunity to not only help in the short term by, getting people out of the overburdened healthcare system, but also long term, the changes that the uptake now among consumers and among the healthcare incumbents, the hospital systems, health plans, how that's going to change the business moving forward. So from your perspective, how is medical malpractice going to change moving forward as a result of this? Is it time for us to rethink how we're managing risk in hospitals?
I think this is the excellent time and the best time to start to rethink risk. Really, we need to start looking at risk as a way to invest. And with the business continuity planning that's happening, it opens us up to many opportunities. We're also starting to get asked questions about business continuity, such as coverages like daycare, interim daycare centers.
Okay.
We're seeing healthcare workers that are having to deal with schools being closed. What do they do with their children? Yet they need to be on the floor and managing that. And sometimes you have dual partners that are working at the same facility or different facilities. So we've been asked for questions about how do we cover interim daycare facilities within hospitals. And all of these things are coming about that are unusual types of coverages. You mentioned earlier too, say you have off-site that you need coverage for because you're trying to test off-site. These are all opportunities to look at ways to leverage things like a captive. Are there things that we can look at to help these healthcare practitioners so that they can invest in those risks so they're not blindsided by them, and so they can start to, I always say insurance is basically a savings account. How do you put your money into a savings account that can help you in the future for these types of rainy days that you can't even anticipate? And so how do we help them start to look at risk as a source of revenue? And how do you look at how we manage risk by giving them information to help them manage it effectively so they can take advantage of some of these risk financing vehicles like a captive or self-insurance that could help them invest for future opportunities. And then looking at it to say, how do you view this risk as strategic? Maybe not now, but once this is over and we start to do those lessons learned, how do we start to look at that and say, invest in that risk, look at it as your strategy, and then start to make sure that you're making good decisions with the financing of that risk. So all of those things are so important.
I was going to say, even to that end, as you're looking, to what I was just saying about, digital health and taking care, increasingly out of the hospital and, and distributing it in different ways and using digital solutions. The risk management on that, I have yet to have a really great conversation with anybody. So Margaret, we may need to have you come back and we'll pick your brain about that. But if you have anything to say in the short term about that, in terms of how hospitals should be, maybe even in this crisis, a bit of advice on, how they should be looking at their risk for people who are using the telehealth services that they provide or who are using, different remote monitoring types of solutions. What's the medmal, advice on that?
Right. So those are things that are happening today, and you're seeing more and more about that. And I think that offers a way, and telehealth has been a remarkable tool in the midst of all of this, because it's a way for healthcare practitioners to actually engage in the practice of medicine without having to physically be present, but having the data and the information to help people. Now, does that expose risk? Yes. But I think it's doing more good than anything else for these patients, especially in this time, so that they're not crowding in the hospitals with people who are infected, who may not necessarily be infected, or who may have less urgent needs to tend to, where practitioners can help them telephonically or even through video. And, how are we going to now start using the data that we get? That will be the next phase of this. But, now's the time to create that, really looking at it and say, not necessarily risk takers, but empowering these practitioners to do what they need to. These are unprecedented times. And sometimes that risk taker is the one that finds the cure and the solution. So how do we arm our physicians and our hospitals with the right information to do that?
Lots of things to think about, Margaret, and especially, I don't envy anybody in one of those healthcare, in a hospital setting, because there is just so much that they're trying to deal with and so many people they're really trying to care for. So thanks for doing your part, I guess, in terms of providing counsel on, how they can think about, from a big picture, the 60,000 foot view of managing the risk for their facility and for everybody inside of it.
Thank you.
Thanks, Margaret. So it's a pleasure to speak with you. We really, I mean, truly, I have yet to, I think, interview anybody in the medmal world. So it's a pleasure to pick your brain. And I'm promising you, we are coming back and asking you more questions about digital health in the near future. But thanks so much for joining us. I'm Jessica DeMassa with WTF Health. Again, what's the future health? If you're interested in hearing more about what some of healthcare's top leaders and innovators are doing in terms of tackling COVID-19 and some of the new thinking that's emerging, like we just talked to Margaret about in terms of risk management or even telehealth and remote monitoring, how data is being used, please check out my YouTube channel. It's youtube.com/WTF Health. Thanks so much for joining us. We'll talk to you soon.